FSM webinar for patients and practitioners. This is Frequency Specific Microcurrent, and it's hard to describe what FSM is and does a little bit. And so we're just going to describe it as a new tool that ends up making old problems much easier to treat. The full history of FSM, if you're interested in more detail than what we're going to have in the webinar, is in the Resonance Effect. It's a book that was just released this year by North Atlantic Books. Jim Osman absolutely loved it. He said it's a can't put it down page turner of a book. Fascinating, funny, inspired, exciting, and altogether delightful. I like that it's all of those things. You can get a signed copy at frequencyspecific.com, or you can get it on amazon.com unsigned. I think Amazon has it at about $9, so it's really reasonable. It's very readable. I hope you enjoy it. So let's move forward. So the first question everybody wants to know is, where did the frequencies come from? Well, the frequencies were developed in the early 1900s, between about 1900 and probably 25 or 30. They were used by thousands of physicians in the US and England in particular, until about 1934. In 1934, the American Medical Association decreed that drugs and surgery was how medicine was going to be practiced. They standardized medical schools and medical therapies to include pharmaceutical agents, and said that any pharmaceutical agents and x-rays, and any physician who used herbs, homeopathy, nutrition, or electromagnetic therapies would lose their license to practice. Now, the Flexner report came out in 1910, and they got a little more serious about 1917, so it took them about 25 years for the physicians who were using electromagnetic therapies to get old, semi-retire, or die. So by 1934, the American Medical Association said, you're going to lose your license if you don't get these things out of your practice. So the machines went in the back room, got covered up by a sheet. They went on the junk heap when Grandpa died. They got donated to the Quack Museum in Chicago. It just generally went away, along with all of the research and all of the material that these physicians generated in the process of creating this treatment methodology. So Harry Van Gelder was a naturopath and osteopath from Australia who was trained in England after the war, moved to North America, moved to Canada in 1946, bought a practice in 1946 that came with a machine that was made in 1922, and that machine included a list of frequencies. So he walks into this clinic, finds this machine in the back room with a sheet over it, and pulls the sheet off, says, what's this? And there under the machine is a list of frequencies. Well, he taught himself how to use them, and with herbs, homeopathy, and nutrition, osteopathic adjusting, and his machine, he became quite famous around in the western United States and Canada. So I got the list from George Douglas in 1995. George got it from Harry in 1983, just the list. Brought it home, and like a good pack rat, stuck it in a drawer, and he ran across the list in 1995. We started using it in my clinic with a microcurrent machine. The microcurrent device had 2 channels, one for tissues, one for conditions. And we started using it in 1995, mostly to treat chronically ill patients, fibromyalgia, myofascial pain, chronic fatigue, 95 and 96, and our results were just so incredible. There were minimal side effects. We found out by using it on each other and on my kids that a frequency that didn't help also didn't do any harm. So in January of 97, I figured I had to teach it to find out if it was reproducible. So we knew by June of 1997, when the students from that class, were about 25 of them, the students who purchased machines were using the frequencies and reproducing the kinds of results that we had found. So I continued to teach it. And over the years, in the last 22 years, the use of the frequencies, the clinical applications have expanded until we are where we are today. And I assume we will continue to learn to use more and do more. The second question people ask after where did the frequencies come from is how did they derive them? And I have to tell you, I have no idea. All of that's lost. There are probably books in the rare book room. There may be old articles from the 1920s that say what they did and how they did it. But I'm not so much worried about how they were derived as whether or not they work. I'm a clinician, so I'm a fix-it guy. Do they work or don't they? That's what I actually care about. How they were derived doesn't really matter. There are a number of frequencies that didn't seem to do much, so I don't use them and don't teach them. Mechanism of action, we actually have some models for how the frequencies work that are now testable for the first time in 20 years. So the technology is available. What we're waiting for right now is both the funding and the right opportunity to find a patient. We can test the genetic expression before and after treatment and see if the frequencies change it. That appears to be the mechanism of action that accounts for all of the data that we have so far. I can tell you that the 1920s equipment was not microcurrent. It plugged in the wall, I think, back when wall current was direct current, but was a microcurrent, and I've never actually seen the original machine. So that's the new tool, is the frequencies used with a microcurrent device. So what old problems do the frequencies in the microcurrent help with? Well, healing injuries, treating you post-operatively or after surgery, and also healing wounds. So the repair limitations in general medicine and in just physiology is ATP production. Can you make enough energy? The body uses ATP as a chemical form of cellular energy. Can you make enough ATP to repair tissue, not just make it work on a day-to-day basis, but to repair injuries, surgical wounds, and other kinds of wounds? How do you improve the blood supply, increase collagen and elastin to repair wounds? Well, microcurrent has been shown in 3 different studies to increase ATP production by 500%. That's 5 times the amount of energy you had, let's say 20 minutes ago, you have now. So what does your body do with 500% more or 5 times more ATP than it did without it? Well, it increases protein synthesis, which is what you need to create repair tissue. In order to increase protein synthesis, you have to increase amino acid transport, does that by 48%, increases cyclic EMP in human lymphocytes, and this is in vivo. That was done by Seegers. It's quite an interesting study if you have a chance to read these references. I believe they're on our website, Not Chain from 1982, and J.C. Seegers from 2001 and 2002. So all 3 papers found that microcurrent increases ATP production by 500%. And activates signal transduction, which just means that it makes it easier for the cells to communicate within the cell and between brother and sister cells. So what actually is microcurrent? Well, current means, it's electrical. So the current is millionths of an amp. It's approved in the category of TENS devices, even though it's 1,000 times less current than TENS. But if you're the FDA and you want to keep things simple, it has batteries, it's electrical, and it must be a TENS device, even if it's, not a TENS device. It's approved for aesthetic use, so estheticians or cosmetologists use it for skin care, getting rid of wrinkles and doing non-surgical facelifts, and that is not a prescription use, using it for pain management or anything medical. the same device becomes a prescription device. It is billed as a TENS device when you use it in a medical practice. The microcurrent devices out on the market vary widely. There's direct current, which is just a straight DC current with no waveform. There's pulsed direct current. There's current that's modified by circuitry, DC current modified by the circuitry to make square waves, sine waves, ramp square waves. We do know that sine waves don't work. I bought a machine in 1998 that just ran sine waves, and it didn't work, so I returned it. One channel, their device, showing that single channel microcurrent at 0.3 of a hertz for 10 minutes and 30 hertz for 10 minutes had no effect on delayed onset muscle soreness as compared to placebo. When Denise Curtis used the frequencies to stop bleeding, 18 and 62, repair the tears in the blood supply, the fascia and the tendons, and reduce inflammation and support vitality in the muscle belly, the fascia, and the tendons, what happened was that the treated leg had a pain level at 24 hours of a 1.3, the sham leg, but the placebo leg. So they had one leg with the machine turned off, one leg with it turned on. The placebo leg, pain level at 24 hours was a 5.2. The treated leg was a 1. At 48 hours, when normally you can't walk after you've overexercised, the pain level was a 7. The treated leg, in the untreated leg, the treated leg was a 1, and the 72 hours the pain starts coming down. Sham leg, placebo leg was a 4, and the treated leg was less than a 1. So that p-value has 3 zeros, 0.0005 at all time measures. Those of you that know anything about statistics know that that is phenomenally impressive, and it ensures that it's not possible by any statistical measure for the results to be by chance or untrue, shall we say. The interesting thing about delayed onset muscle soreness is that there is no other effective treatment. Can't be done. So that makes FSM very important for the National Football League, the National Hockey League, a couple of baseball teams, and a couple of basketball teams. One of the things that happens when you get into professional and Olympic sports is everybody wants to keep their secret secret. So we are probably the best kept secret in the NFL, aside from the 6 or 8 teams that found out about us when I was treating the Philadelphia Eagles. Post-operative pain, this study was done by John Cale in 2013. And the important thing about this is that there are other people doing these papers besides me. This is not just, you know, a Dr. Carol McMakin thing. This is Dr. John Cale. He does, he's an OBGYN. These patients were after C-sections. So FSM actually shortens the hospital stays. His patients FSM patients got out of the hospital about a third of a day, half a day sooner than the control patients. And the control patients were from the hospital records who were treated the way any other patient would be after a C-section with pain medication and just exercise and tincture of time. Post-operative pain was probably the biggest thing. You want patients to get up and walk. So the pain with activity with FSM was less than a 3, and without FSM was a 5. So that p-value has 3 zeros and a 1. That is hugely statistically significant, even with a small n of about 20. Diabetic wounds have a terrible time healing because the blood supply is compromised. And if you can improve vascularity, reduce inflammation, and build collagen and elastin, what happens is those wounds heal. This is a 7-centimeter wound that is gone 9 days after the first picture on the left. 6 treatments, 3 weeks, but if you look at the difference between this hole over here on July 10th and this hole here on July 9th, this is how much it healed in 9 days. But Dr. Collier is saying that it took 6 treatments in 3 weeks. necrosis in the second digit. That was pretty far gone. It was dry gangrene. It was not infected. It was just necrotic. And it resolved in 12 treatments, and I think 6 weeks, 12 treatments in 6 weeks. This third digit resolved in 7 treatments in the 6 weeks. So what this means for this patient is his toe's not going to get amputated. And that was where he was headed. They were actually waiting for it to get worse so they could see where it was going to go, to see if he'd have to take off more than one toe so they could do the surgeries all at one time. Peripheral neuropathy, this patient had pain and numbness. These little X's are places where it was numb. Pain and numbness. And in 8 treatments in 4 weeks, his feet a completely normal sensation, whereas before they were numb and painful in 8 out of 10 areas on the foot. And this was completely normal sensation in 4 weeks, 8 treatments in 4 weeks. So this patient was treated twice a week for 4 weeks. So inflammation, degenerative diseases, and immune activation cause most of our degenerative illness comes from inflammation and immune system activation. So these are old problems in medicine, and we handle it with diet and anti-inflammatory drugs. The problem is they take too long. The drugs have too many side effects, and the fact of the matter is that inflammation is hard to change. Cytokines in particular are very hard to change with diet and even anti-inflammatory or anti-immune system activating drugs. So you have to ask, what would happen to this problem in medicine, all of the degenerative diseases, if you could reduce lipoxygenase-mediated inflammation by 62% in 4 minutes and COX mediated inflammation by 30% in 4 minutes? Well, this is one of the few blinded animal research projects we've ever had done with FSM. And this was, they paint arachidonic, this was done at University of Sydney in Australia. They paint arachidonic acid on the mouse's ears and then measure the swelling. And in an untreated mouse, this is how much it swells. And then they do something. They give it a drug, they inject it with something, they do something to it to see if that will reduce the inflammation. Well, in this case, they treated the mice with microcurrent. This is Wayne Riley holding the mouse with the graphite gloves worn on his hands. We don't do this anymore, but the frequencies are the same. He used 40 hertz on channel A and 116 hertz on channel B. And in the mice that were painted with arachidonic acid that creates a lipoxygenase-mediated cascade of inflammation, there was actually a 70% reduction. But the researchers said she'd never seen any drug, prescription or non-prescription, that reduced inflammation by more than 45%. So she shut down the lab, blinded everybody in the lab by moving them into different rooms, and repeated the experiment the next day, and it was still a 62% reduction in lipoxygenase-mediated inflammation. And then they painted myristoyl steroid on the mouse's ears, which creates a COX-mediated inflammation. So you've all heard of COX-2 and COX-1 inhibitors. It created a 30% reduction in COX-mediated inflammation, which doesn't sound so good, but that is equivalent to injectable Toradol when it was tested by the same researcher in the same animal model. Injectable Toradol is what they give you after a knee or a hip surgery to reduce inflammation. It's used routinely in hospitals after surgeries. All the animals responded, and what was interesting is it's a 4-minute time-dependent response. So half the effect was there at 2 minutes, the full effect is there at 4 minutes. And then they tested other frequency combinations to find out, would just the current be enough to reduce inflammation? So they had 4 minutes of the frequency 1/10 of a hertz, and that on each channel, and that produced no reduction in swelling. 4 minutes of our frequencies for reducing mineral deposits in bone, and that gave no reduction in ear swelling. 4 minutes of yet another frequency combination for what we call the intermediate injury protocol gave no reduction in swelling. And then actually did 4 minutes of the frequency to reduce inflammation in the skin, and that gave no reduction in ear swelling, which was surprising. The only frequency that reduced the swelling in the mouse's ears was the frequency to reduce inflammation, 40 hertz, in the immune system, 116 hertz. So then they sunburned the mice, and at this point, most of us are feeling a little bit sorry for the mice, but such is research. When you expose a hairless mouse to ultraviolet light and don't treat him at 21, 23, 25, and 27 hours, this is how much his ears swell. These ears are measured by those calipers you saw in the first picture, okay? So this is the group they treated immediately after the sunburn with microcurrent, 40 and 116, and it had no statistical, it's a little bit reduced, but not enough to achieve even mild statistical significance. This is a group that was treated at 2 hours with 40 and 116, and that is, as you can see, significant. Reduced the swelling at 21, 23, 25, and 27 hours in particular by 0.01 and 0.05, and this is 0.01 statistical significance at 27 hours. So there's a thing about sunburn that I didn't know, and that is that sunburn suppresses the immune response. So when they sunburn a mouse, it reduces immune system activity. So the way they test this is to paint a contact sensitizing agent on the mouse's leg, hind leg, and then 2 weeks later, they paint it on the mouse's ears. And if you do that to a mouse and you don't sunburn it, the normal amount of swelling is this. I think that's 31 or 30, 30 units of swelling, probably micrometers, okay? So this is a non-sunburn group. You paint oxazolone in his hind leg, and then 2 weeks later you paint oxazolone in his ears. The group that was sunburned, I didn't know this about sunburn, but there it is. If you paint oxazolone on the mouse's hind leg, then you sunburn him, and 2 weeks later you paint oxazolone in the ears. The immune suppression, the immune response is suppressed by 63.4%. So that is an IS, which stands for immune suppression, by 63%. The group that was treated at 2 hours that had the best reduction in swelling had their immune system suppression reduced from 63 to 57%, which is nice for the mouse. It's not as swollen. They had the best reduction in swelling from the sunburn, best sunburn response at 2 hours, and the immune system suppression at 2 weeks was reduced from 63 to 57%. The group that was treated immediately, however, that had no statistical significance on swelling caused by the sunburn, had their immune system suppression reduced by half 2 weeks after it was applied, 2 weeks after the current was applied. So the immune system suppression went from 63 to 31% 2 weeks after it was applied. Of all the data we have, including what you're going to see with the cytokines, this slide took me the longest to figure out, also had the most profound implications for everything that we do. The thing you need to get your head around with this data is that a single 4-minute application of one and only one frequency combination created a permanent change in immune system activation as measured 2 weeks after the original application. This gives us profound implications in everything we treat that has an immune system component, such as asthma, COPD, irritable bowel, Crohn's disease, pancreatitis, ulcerative colitis, liver disease, rheumatoid arthritis, and degenerative arthritis are all known to be associated with lipoxygenase and cyclooxygenase inflammation. It's associated with all degenerative diseases, all of the neurocognitive disorders, are LOX and COX mediated and have elevated cytokines associated. So the implications of the sunburn, the mouse sunburn study, are fairly profound for all of these conditions. Now, what would happen if you could reduce all of the inflammatory cytokines in 90 minutes, and what if they all stopped in the normal range? So there are pharmaceutical agents that reduce the inflammatory cytokines in autoimmune disease, but the problem is they take them below the normal range, and so the patients end up having problems with cancer and infectious disease because the cytokines are too low. So that's where this "what happens if they stop in the normal range" comment comes from. We measured, and well, we didn't, this gentleman at the National Institutes of Health measured cytokine changes with microcurrent treatment of fibromyalgia associated with spine trauma. There were 54 consecutive fibromyalgia patients with a history of trauma that preceded their onset of fibromyalgia. They had an average chronicity of 9 years with a range of 1 to 50 years. There's blood sample data taken on a subset of 6 patients that I sent to NIH. I actually have data on 13 patients, but there are only 6 that met the inclusionary criteria for this paper. They did not differ in age or chronicity. The control patient was a patient that had myofascial pain from trigger points. She did not have fibromyalgia from spine trauma. She had been misdiagnosed, and she didn't have fibromyalgia. She just had myofascial pain from trigger points in her neck and low back. So 28% of fibromyalgia patients have their fibromyalgia from some sort of spine trauma, auto accident that follows some sort of neck injury or spine injury, a fall or lifting injury. It's probably actually higher than that because some of the patients don't count like certain kinds of activities that impact the neck. They don't count that as a neck injury. So my experience with fibromyalgia patients suggests that it's closer to 35 to 40%. So only one frequency combination that's effective in this group, and that's 40 hertz on channel A and 10 hertz on channel B. And the paper says that we picked that by trial and error, but it's not real trial and error. 40 hertz on channel A is the frequency to reduce inflammation. 10 hertz on channel B is the frequency to address the spinal cord. All of these patients had their pain go from an average of a 7.4 to a 1.3 in 90 minutes. The recovery, once you get their pain down, the fibromyalgia is not gone. It's an endocrine condition, pain neuroendocrine condition. The recovery from fibromyalgia was individualized. They had FSM in the office. Some of them had a home unit. They all got physical therapy. They all needed reconditioning. They all got supplements for the digestive system, the irritable bowel, adrenals. Some of them had interstitial cystitis. So all of that, these data points down here on this graph, there's no scatter. This patient up here that says didn't respond, her pain level didn't come down because she had spinal cord compression associated with from a disc injury. But the rest of the patients, there's no scatter. So that was interesting. There's not much variability in this data. So it's like not small changes. These are huge. The endorphins go up after about the 15 to 20 minute mark. These patients are so stoned that they really, stoned is zero. It's the only way to describe it. Their endorphins have gone up by a factor of 4 times at this point, and they end up going up by a factor of more than 10 times. And right about the 20 to 30 minute mark, they're so stoned that they really don't want to open their eyes. And they'd rather not talk, and they would really rather that you kept quiet as well. Cortisol goes up, but it turns out not to be a stress response. It turns out that if you increase endorphins, you're also going to increase ACTH, and if you increase ACTH, you're going to increase cortisol. It's not stress response because neuropeptide Y goes down. We didn't publish the neuropeptide Y data. We also didn't publish the serotonin data because serotonin was different. Serotonin was interesting. It dropped and then it turned around and went back up when we ran something that we call the concussion protocol. all of them had their pain levels go from an average of a 7.3 to an average of a 1.3. It's kind of nobody this doesn't work on. They all leave with their pain at a 0. The p-value on this pain score reduction has actually got 6 zeros, but the statistician was British, and he said anything more than 3 zeros is showing off. So we only published 3. That's the tradition. All patients experienced pain relief. 58% of them experienced resolution or cure of their fibromyalgia within 4 months. One patient did relapse, but the rest of them had improved tender point sensitivity, improved sleep quality. They got off their medication. What was interesting was 13 out of the 53 discontinued treatment for reasons not related to treatment side effects. So it's not that the treatment was unpleasant. My impression over the years has been, especially back in the early days, we didn't handle this very well. If you had your pain level a 7 for 14 years, and somebody gets your pain down to a 1 in 90 minutes, at the end of that 90 minutes, who are you? That's a bit of a problem. So I wasn't very good at handling that back then. It's gotten better now, and now the course is taught so that the practitioners have a better idea about how to manage fibromyalgia patients and help them recover. So this lady was 18 years chronic, and in 8 weeks, she no longer met the diagnostic criteria for fibromyalgia. At 12 weeks, this is roughly our average, she had officially recovered from fibromyalgia. She moved from Portland to Colorado, and at a 6-year follow-up, she had still maintained her recovery. So it's the original name of this paper was not cytokine changes. The original name of this paper was Resolution of Fibromyalgia, and nobody wanted to hear that it was curable. So we changed the name to highlight the cytokine changes, and that they found more acceptable. So functional medicine is a new approach to the old problems in medicine. It's like a systems biology approach to chronic illness. It works really well, but it takes too long, and in general, it costs too much because you're doing diet and supplements and lifestyle changes. And the body can heal doing that, but it takes a long time, 6 to 12 months in their data. And it's expensive because of the supplements in general. When you combine FSM with functional medicine, FSM works immediately to reduce the pain and increase ATP production, reduce inflammation, and help all of the chronic diseases that functional medicine is useful for. FSM works immediately, but it has to have a functional medicine approach to create a lasting, stable state that allows those improvements to persist. So, old problems in medicine for patients and for doctors: nerve pain, muscle pain, scar tissue. Those are problems because the treatment takes too long, costs too much, and the available treatments are not very effective. One of the big controversies about myofascial pain is that the trigger points have to be psychogenic because it's so hard to treat. Well, FSM makes myofascial trigger points easy to treat, so the treatment does not take too long, is fairly inexpensive, and is incredibly effective for nerve pain, muscle pain, and scar tissue. So we published 20 cases in 2010, where the average chronicity was 6.5, almost 7 years. All patients experienced pain reduction. The pain at the first treatment went from an average of 7 to about a 1.8, about a 2. That p-value has 2 zeros. On the second treatment, they came in up a little bit at a 4.8, but they left at a 0.9, at less than a 1. So that p-value had 2 zeros as well. So at the end of it, they were fully recovered in an average of 4.6 treatments. One patient took as long as 15. You have a disc injury where the disc needs to be repaired, makes the nerve harder to treat. 65% fully recovered. There were no adverse reactions aside from that rather pleasant getting stoned endorphin increase that we saw in the fibromyalgia patients. Anytime the frequency is correct, the endorphins go up. However, 25% terminated care prior to recovery. And that is, once again, if your pain level has been a 7 for an average of 7 years, and somebody gets it down to a 1 or a 2 at the end of 90 minutes or 60 minutes, who are you? So I believe that FSM in these cases, in fibromyalgia and in neuropathic pain, FSM creates an existential crisis that's more or less unparalleled in medicine because nothing works this fast. So at the end of 60 minutes, your pain's gone. Now who are you? Quick. So it's an interesting conundrum. Cervical and myofascial pain are trigger points in the neck, head, neck, and face. It's 5 years average chronicity. The range was 1 to 28 years. 88% failed with other treatments. It took 11 visits in 8 weeks to get them from a pain level of an average of a 7 to an average of a 1.3, 1.5. And that really only took 11 visits in 8 weeks because I didn't know what I was doing. In the cervical spine, an awful lot of the trigger points are maintained by disc injuries, facet injuries, and ligamentous laxity. This was 1990 of the fixed the scar tissue on his hands, although we got the scar tissue in his neck and his chest repaired pretty easily, but his hands needed surgery. So this is a picture taken after his surgery. But every patient had statistically significant permanent increases in range of motion after 3 one-hour treatments. And these were full-thickness burns with scarring, significant scarring. That was done in 2003. We did research on animals at Baylor Medical School with Dr. Weissman. He has a method of surgically inducing abdominal adhesions in rats. So you score the cecum and the abdominal wall, and you stitch them together. And at the end of 7 days, you have an adhesion that has to be cut with scissors because the scalpel won't, just kind of bounces off of it. It's cartilaginous, it's hard, it's tough. It is really gnarly abdominal scarring. And I had about 6 frequencies we're going to try. We got permission to anesthetize 3 rats, open them up, run the current on either side of their abdomen. And had about 5 frequencies I wanted to try, and the 4th one I tried in the first rat was 13 hertz on channel A and 77 hertz, the connected frequency for connective tissue on channel B. And that took this white, hard, cartilaginous scar and literally melted it, like turned it clear and slurpy. And it was kind of like snot. It just liquefied. It's very strange. And that same frequency did the same thing in all 3 rats. So then the next day I treated 8 chronic abdominal pain and pelvic pain patients, and the frequencies did the same things. Not only did this work in animals, it worked in humans. So dissolving scar tissue is really pretty easy with FSM. It's actually kind of fun to treat patients with chronic abdominal pain because they respond so quickly with not only pain reduction, but improvement in how the abdomen just becomes softer and more mobile. FSM and manual therapy is a good combination. This is Kim Pittis. She loves her job. She's a sports instructor. If you see an FSM sports course, I suggest you take her class. It's a 2-day course. It's aimed at sports practitioners. And FSM is, for those of you that are manual therapists, FSM is used really well in combination with manual therapy. It's not an instead of thing, it's an addition to thing. So as you might have guessed, Frequency Specific Microcurrent is the new tool we've been talking about. We use specific frequencies that we got from this osteopath who bought a practice in 1946 that came with a machine and a list of frequencies that were created in 1922. So the frequency to reduce inflammation, reduces pain, redness, swelling, but doesn't change range of motion, doesn't do anything for scar tissue. Frequency for scar tissue reduces fibrosis and scarring, dissolves scar tissue in the rats and the people, increases range of motion, doesn't do anything at all for swelling or inflammation. Frequency to stop hemorrhage, stops bleeding and pain in the menses, and prevents bruising in injuries. You use this frequency postoperatively in people after hip replacements who don't bruise. Mineral ion deposits soften tissue, reduce pain, some changes in motion, but mostly it just changes the calcium ion hardening that happens in fascial tissue. There's one frequency, the only thing it's good for is shingles and oral and genital herpes. And there's one frequency, the only thing it's good for is kidney stone pain. It's effective in every case, but it's not useful for anything else. This is a frequency for, this is a case report published in Shingles. He's an 85-year-old man. We had one frequency combination that was used for, well, he was pain-free in 1 hour, but because he was 85, and it was in the ophthalmic branch of 5, and that cranial nerve, he was pain-free in an hour. Pain never came back, but we treated him for an additional 3 hours, 2 hours that first day and 2 hours the second day, and the lesions were gone, dried up, and on their way out in 48 hours. He never had a return of pain after the first hour of treatment. So you have to be asking yourself, how is it that frequencies could change tissues and conditions in specific tissues? How does it do that? So the short version, now there are books you can read about this. I recommend that you read Jim Oshman's Energy Medicine, The Scientific Basis. But the short version is, human body is a quantum biological system, right? Living tissue is biochemicals. Well, biochemicals follow the constraints of Newtonian physics, and so do you, because you're a large body, right? But when you get down to molecules and atoms and subatomic particles, you know, the fact is Newtonian physics kind of doesn't hold up very well. So that's where you end up understanding quantum biology. So molecules, atoms, and subatomic particles in your body are held together by electromagnetic bonds, right? You're actually more space than you are stuff, and you're held together by electromagnetic bonds. And the important thing about bonds, about electromagnetic bonds or chemical bonds or any kind of bonds, is every bond is the cellular expression. So biological resonance explains the effects of frequencies on living tissue. We're all used to drugs and nutrients that act like keys in a lock to change membrane receptors and change, like a key in a lock, intracellular function. So anti-inflammatories work by changing the way this receptor operates and changing the way the cells respond and produce inflammation. They are anti-inflammatory by operating like a key in a lock. So biologic resonance is the effect of the frequencies on living tissue. When the frequencies act like your key fob, opening that same lock with an electromagnetic signal, right? It changes membrane protein configuration and cell function electromagnetically, and acts as if the frequencies act as if they dissolve scar tissue crosslinks, which are held together by very specific frequencies holding the connective tissue in a shortened and tightened configuration. It acts as if it disassembled the virus capsid that creates shingles. How else are you going to get rid of shingles in an 85-year-old man in 4 hours? This is the only mechanism that makes sense. And it acts as if it changes cell signaling, because when we reduce the cytokines, all of the cytokines stopped in the normal range. Cytokines are made by cellular genetics, and normalizing cell function and changing cell signaling is the only thing that makes sense for how we could change the cytokines that quickly and why they all stopped in the normal range. You can learn the frequencies and learn how to use FSM in the textbook, Frequency Specific Microcurrent in Pain Management. I didn't want the frequencies to be a secret. I want patients to be able to be helped. I want everybody to be able to use them, and I want patients to find relief and practitioners to find a new tool that will help them solve their problems in medicine and patient care. The resonance effect gives the frequencies for a lot of the visceral conditions. We don't have enough research in the visceral conditions to write a textbook, but this is a storybook. This is a story of case reports. It is not fiction. This is what really happened and how we developed FSM and how we discovered that it's good for irritable bowel and Crohn's disease and asthma. And the protocols are actually, the frequencies and the protocols are actually included in the resonance effect, and it's a fun read. I recommend it to you very highly. So we now teach FSM, Frequency Specific Microcurrent, as a 4-day seminar. It's like learning a language in 4 days. It's an incredible amount of information. By Sunday night, practitioners' brain is full, but they are safe to go out and purchase equipment and use FSM in their practices starting Monday. FSM is the new tool that solves old problems in medicine. We have 4-day seminars. We're in Jacksonville. We're going to be in Chicago next week, October 26th to 29th. We'll be in Nuremberg in December, Cleveland in January, Phoenix in February, Portland. The whole Frequency Specific Microcurrent seminar schedule is on the FSM website, frequencyspecific.com. If you're a patient and you're listening to this webinar, send your practitioner and have the practitioner treat you for whatever it is that we can help you with. Look for the discount coupon, the core, it'll say core 200 because it's a $200 discount off of it. And I understand we have 2 questions, which are?
Let's see, the first one, how do we know there won't be long-term side effects?
Well, how do we know there won't be long-term side effects? That's a really good question. Initially, we didn't, but it's now been used for 22 years. I've been using it on myself, let's see, every night, more or less, at least 3 days a week for the last, 15 years. We've been treating patients since 1997. None of them have reported any long-term side effects. When you reduce inflammation like with drugs, it stays gone alone. The drugs take a long time and they keep the inflammation down for 6 to 12 hours. With FSM, the inflammation is dropped even more dramatically, but it's down for about 4 to 6 hours. And when it comes back at a more normal level because you're changing cell signaling. So after 22 years, if there was going to be any long-term negative effects, we would have known about it. And in the seminars, I warn practitioners about every single side effect that I've ever seen or every negative effect I've ever seen. So if there were any long-term negative side effects, I'd let you know about it.
And then,
one more question.
Ever try using it on keloids?
Oh, do we use it on keloid scarring? Yes, and there are frequencies that are useful for that. It takes the ridging down, it takes the hardness of the keloids down, it flattens them and softens them, doesn't make the skin normal. So you can still tell there's a scar there, but it's not ridged and hard like keloids generally are. Internal keloids, even like the really dense abdominal scarring you get from endometriosis and Crohn's, and those are probably the 2 worst. Those just sort of melt. Keloid surface scarring is going to melt. When Kevin was reading that question, I thought, do you ever use it on animals? FSM has been used on racehorses, on regular horses, sport horses, dogs, cats, no fish, no birds, but dogs, cats, and horses, and cows, and sheep. So those are it works in animals. And if you're going to have a placebo effect, like horses don't have a placebo effect. They just want you to go away and leave them alone. There's a great horse story in the resonance effect. So yes, it works in keloids. So here's the other thing you need to know about FSM. It will change your life. Once you see what you see at the seminar, once you know what you know, you can't unknow it and you can't unsee it. And the frequencies change your life. those of you that are practitioners, it'll change your practice once you start using it, and it'll change your outcomes. And when it changes your outcomes, it changes your patients' lives forever and forever. So I invite you to join us and enjoy frequency specific microcurrent and what it can do for you and your life and your practice. There was a hand raised. One more question. Nope. Okay. So check the website, frequencyspecific.com, and enjoy the resonance.